Hi, this is Laura Lee Waldorf, and I'm here with Kathleen, and we're at Bonnie Prudden Recertification for Myotherapy. Kathleen, how did you discover myotherapy?
Well, I was a nurse in the Air Force, and I always had to get continuing education credits. And I've always been very interested in holistic health kind of models. And as a nurse in the hospital, I never really felt that I was giving the kind of healing that I wanted to give. It wasn't really a personal enough a touch. And I never really felt like I healed anybody. It was just passing out medications and taking on doctor's orders and so on. So I went to massage school first, and at the end of massage school, the teacher handed out some books that we might like to read additionally to learn more about other modalities of healing that were out there, sort of dovetailing it with the massage therapy. So Bonnie Prudden's book was handed out to me, and I looked at it and I said, this is what I want to do. This is way more therapeutic. I didn't really want to be a spa-type massage therapist, and I certainly wanted to use my nursing skills. So I thought the Bonnie Prudden Myotherapy was the thing. So I called the number on the back of the book, and actually Bonnie answered. We scheduled an interview, and I met her, and I really loved her. And she thought I would be a good fit for her school, and I did too. So that's how I went to the Bonnie Prudden School and became a Bonnie Prudden Myotherapist.
Wow, that's awesome. That's a different story than most people. They usually found it with their injuries, right?
Right.
So it's interesting to not know, but actually have a passion about it because it makes sense.
Oh yeah.
And the fact that it's connected with what your background already was a perfect fit.
Yep, it really was.
So what has been your experience after that decision?
Yeah, so my husband at the time and I had a family practice clinic, and it was great because all the patients that he couldn't fix because they had musculoskeletal pain, he would send them to me, and I could work on them together in the office, and did that for 20 years. I really liked the autonomy that it gave me. I could schedule my own patients when I wanted. It's just a great way to raise your kids, have a life, and have a really great professional working career. You can fit it all in, and what I really loved about it was everybody that I worked on felt better. And it was so good to teach them the corrective movement, because after that, then they would be pain-free and maybe never had to come back to me. So it wasn't a model that I wanted. I didn't want to see everybody coming back and back and back. I wanted them to get better and then pass it on. Do it to their families. Do the myotherapy on their families, their kids, their parents, their friends. And so then the world could be made a better, more relaxed, muscle pain-free world, one person at a time.
That's right. There you go. So how do you do myotherapy? Do you have to use oils or take your clothes off or anything like that? Or
so the best part about myotherapy is that it's not a big deal as far as getting undressed and being in a darkened room with perfect mood music and lighting. It can be done anywhere, anytime, at somebody's house, at their office, in a chair at a restaurant even. And you don't have to get unclothed. Depending on where the tension is, you could be sitting up. You don't necessarily have to be lying down. However, if someone comes to you for a full treatment, of course there's a treatment table there, and there's lots of ways to approach myotherapy.
So you work with trigger points and stretching. And you teach people how to do this. The difference that I see with myotherapy is it sounds as very empowering for people.
Right. So if somebody has pain already, they're not feeling really good about things because they've been maybe to other practitioners, doctors, and things, and they can't get rid of the pain. Maybe they don't want to take medication to do it, or maybe they really want to learn how to get rid of their own pain. So myotherapy gives you the option to not only get treated on, but then learn how to do it so you can do self-care and take care of your own pain. Sometimes it's quick, and sometimes life just dishes out tension every day. So maybe you get rid of your pain for today, but maybe something comes back later. You don't have to go to perhaps a therapist. You can work on it yourself because you know what to do.
And you're Johnny on the spot too.
Yeah, that's right. And you can nip things in the bud before they become an issue. Maybe you don't want to go to the doctor because you either don't have the money or you don't have the time. But if you know how to work on yourself, you can do it anytime, anywhere at your own convenience, and you always feel better. You never don't feel better after you lay hands onto yourself and take care of things. So
with myotherapy, what does a treatment look like? What is a trigger point? How do you work? What tools do you use?
So if somebody comes to me, to my office for a full session, not not something quick, but a real scheduled session. So we would talk about, I would get their history and find out where their pain is and what kind of things happened to them prior to getting it. Was there a recent injury, were there previous injuries, what things happened in their life that got them to where they are today with the tension that they have, what kind of job do they have, what kind of exercise do they do. I even ask what kind of food they eat, just because I like to get a whole big picture of the person. And then we make a treatment plan from there. A trigger point is a spot, an irritable place in the muscle that delivers pain. And so we use pressure points, we use little implements called bodos that can access a trigger point maybe better than a thumb or an elbow can do. And then we teach, right after we work an area, we stretch the area out and show them how to do these all at home. So because if you just get rid of a trigger point and just stretch it one time, it's probably going to not really dissipate all the way. So you really have to work on this at home because you didn't get the tension in a day. You build up the tension over months, years. So it's going to take a little while to really, really be pain-free. But as far as treatments go, maybe 3 to 5, perhaps even 6 sessions. But all during that time you're being taught things that you can work on yourself at home. So it's not, you never leave there empty-handed. Some people like to leave the doctor with a prescription pad. I like to send people home with a homework sheet so they can work on the things at home and get better.
And they're empowered for the rest of their life, basically.
That's right. Because once you know how to treat things on yourself, you immediately feel better about, you have more control over your life and your pain and what other things might come into your life as far as accidents, stress, injuries. You know how to deal with it.
Wow, this sounds like a really good career to have.
Everybody should know how to do this. It's like should be in everybody's first aid kit, knowledge of myotherapy.
There you go, or in high schools or something.
Yeah, that's right.
Yeah, that would be a good class. Maybe we'll move into that eventually.
Think about that.
So do you want us to contact you anyway? How do we contact you?
So to contact me, my email address, which is kmacwaddell@aol.com.
Can you spell that?
Sure, KMACWADDELL@aol.com. Or by phone. I live in North Carolina, so it's 910-692-9666.
Well, thank you, Kathleen.
Well, thank you.
Love life and life will love you back.
Yeah, that's it.
Okay, bye-bye.
Bye.